So here is a interview of Dr. Jaiben George. He has done his MBBS from All India Institute of Medical Sciences, New Delhi. He has been ranked number 1 in the All India Institute of Medical Sciences entrance examination during his UG days. After that, he pursued for the USMLE steps and he scored really good. The rest of the story, he's narrating himself how much he scored and what all he did during each step to score this much. So stay tuned, and I hope you guys will like this video really very much. Please subscribe to my YouTube channel for more such videos and keep supporting.
Hi, my name is Dr. Jaiben. I did my UG from AIMS and I was a USMLE aspirant. I took my all the 3 USMLE steps and I scored 276 in step 1, 267 in step 2 and 242 in step 3. Having cleared all the steps, I would like to share my experience about taking the USMLE steps. I took my step 1 during my 7th semester. So as you know, like the step 1, during step 1 they test your knowledge from the first and second year topics. So I was actually right out of my second year, so I knew the topics very well. So it helped me with my preparation. And as all of you mostly know, the tools which I used for step 1 were mostly first aid and UWorld, which were the base for my preparation. But apart from that, for each subject, I did learn individual review books. So basically, the way I did was I started with learning each subject with one subject each. I started with the first year subjects, ANAT, Physio, Biocom. Then I went to the second year subjects. So for each of the subjects, I use a specific review book. I don't think it matters much, but I guess you don't have time to read the entire topic because it's so vast. So the key is to just review each subject. So just focus on just 1 or 2 review books for each subject. It could be like Kaplan or High Yield or any of those books. Then once you go through each of these books, then you have an idea, or you just basically get a refreshment of your knowledge from the first year and the second year. And once you know these subjects, you just review your knowledge by doing more and more questions and doing the first aid. So first aid is like a composite book which includes and which is like a summary of all the subjects. And so what I did, I went through each of the subjects, then I did like my first aid, then I was just basically doing more and more questions from UWorld. And I think doing UWorld maybe 1 or 2 times is key, because it contains updated questions, and it really gives an edge for the USMLE exams. So just practice doing more and more questions. And also you have NBME and other tools which are provided directly by the USMLE, which gives you an idea about what type of questions you get for the exams. So basically that's it. So for each subject, you go and do like 1 review book. Then first aid is like a summary for all the subjects, and then you keep on doing more and more questions. And the key for that is the UWorld. Talking about the step 2, as you all know, step 2 tests your clinical knowledge. So it basically asks questions from a clinical perspective. It tests the 3rd year and 4th year subjects. And here again, I studied each individual subjects from Kaplan, and it gave you an idea of the clinical setting and the clinical practice in US, because although the basics are the same in here or in US, but sometimes the management guidelines and the treatment protocols slightly differ. So it's very important to know what is the next best step, or what is the best modality for investigation which is used in US. So it is very important that you go thoroughly through one or the other review books. So I use Kaplan for each of the subjects. Then I use MTB, which gives you an overall idea on each of the subjects. and once you kind of know, then I guess it's good idea you go to UWorld, because no, unlike step 1 where you have first aid is a very good resource, in step 2 you don't really have like a single book which which gives you a good knowledge for all the subjects. So it's very important you learn from the UWorld and try to do more and more questions, and the topics which are frequently tested, it's good you study them from some other resource like Up to Date or something like that, so you get what is the current management protocol for that particular condition. And the UWorld again here is a very good resource. It gives an updated guidelines and updated protocols for management of various conditions. The clinical skills part, or the CS part of the step 2, is a very important part of step 2. Here you have to go to the US, because there are only 5 centers where you have to go and take the exam. As you know, this is a practical based exam where you get hypothetical cases, and you are supposed to take a history, and from these standardized patients you need to examine and elicit findings, and based on the history and findings you are supposed to write a clinical note and make your differentials. So you are tested on your clinical skills here. The key for CS is practice. There are first aid and some other resources which gives you an idea of the kind of questions or kind of clinical settings which you get in a CS. All you need to do is just practice with someone and try to be thorough with the clinical history taking and the clinical examination, and also be confident and fast in writing the notes, because most of the diagnosis or the clinical settings which you find in a CS are pretty common illness, like fever or some common cold or abdominal pain. So it's not like crazy diagnosis, it's just that simple diagnosis, so it's not hard to make a diagnosis. The only thing is that you just need to practice yourself, and so that you are like on the day of the exam you can easily take a history and do a quick examination, and you can write the notes briefly and thoroughly. Talking about step 3, which is the last part of the USMLE, you can take step 3 even after you take your residency. So step 3 is not always a requirement to apply for residency, but it's just a requirement for practice in US. I think as international graduates, to take step 3 we need to be CFMG certified first. That means we need to clear both the step 1 and step 2, as well as we need to graduate from our medical school. So once we are CFMG certified, we can apply for step 3, and the step 3 is a 2-day exam which you can space out for a period of 7 days, and in the 2 days you have an objective exam, like multiple choice question exams, which are around like 300 questions, and in addition to that you have a clinical simulation of cases. There are around 10 CCS cases which are clinical simulations of real life patient cases. So the MCQs are pretty much like CK, maybe slightly more into clinical aspects like management and treatment parts, and the CCS are kind of simulated cases in which you are given a patient, and you have a software in which you can take history, and based on your questions they give you findings of both from history, the clinical aspects, also you get the lab findings, and based on that you have to make your diagnosis, and you also have to initiate treatment. And if your diagnosis and treatment is right, you can see the patients improving. Here again I used UWorld, which I think was the key. UWorld has a lot of questions for the step 3 preparation, and they also have softwares which help you with the CCS preparation. And as books, for me I use MTB. I think it may not be that comprehensive enough, because as you know, once you're coming into step 3 level, your knowledge from different aspects of medicine are tested, so you need to learn a lot. But I think MTB is in a small book which helps you to cover most of the important topics in a small amount of time. And again, as other steps. UL is also very important here.
So this was the interview by Dr. Jaiben, and basically he comprehensively, explores all the resources which he used during his preparation. And basically what I felt from his interview is that UWord is the most important resource which we all need to use for our USMLE exams. For step 1, we already have first aid. We know that we can rely on first aid and UWord. But for step 2, it's a very tricky and dicey situation for all of the med students, because we don't have a particular resource on which we can rely upon. So UWord remains the whole and soul center of USMLE step 2 CK. MTB is also there, Kaplan is also there, but in my opinion, and Dr. Jaiben also said that these resources are not that useful in your exam because they don't cover all the topics, and for these exams you need to know the different clinical scenarios. So the more questions you solve, the more clinical scenarios you'll come across, and definitely your clinical acumen will improve and you would perform really well in your exam. So this was a short interview. I hope you guys liked this video, and for me to make more such videos, please just support and subscribe to my YouTube channel, and let me know in your comments if you like this video, so that it motivates me to make more such videos. And I have few friends who scored really exceptionally good in these examinations, so I can interview them as well. Only if you guys like this video, please let me know in your comments, and please subscribe to my YouTube channel. Thank you so much, and keep studying really well. Good night.